Digital Hospital has functionality to help staff with the management of deteriorating patients. Good morning, Sam. My name's Cornelia and I'm your nurse today. I'm going to be taking some OBS. Once I have completed the patient's observations, I will send them to the IEMR. The IEMR is the source of truth for early warning score alerts, as devices will not be able to take into account altered calling criteria. In this example, Sam has scored a 0. Therefore, no pop-up alerts will display. I will also view the Managing Deterioration page, which shows me a graphical representation of trending observations. The flyout option allows you to view the vital signs without having to scroll. Another set of observations has been sent to the IEMR. The early warning score has increased. An alert will appear in the IEMR with instructions to be followed. When navigating to the Managing Deterioration page, if any red or yellow alerts appear on this page, check your patient, acknowledge the alert, review the patient's early warning score, and take action accordingly. If concerned, call a MET call. Another set of observations has been taken. The early warning score is over 8 or in the E range. An alert to call a MET has popped up. A similar message appears on the vital signs monitor. The local procedure for a MET call will be followed. Hi, I'm just calling a MET call in Ward 3B, Bed 3. Thank you.
Hi, we're the MET team. Thanks for calling us. What's the situation?
Clinical handover then occurs, with each team member introducing themselves with their full name and role, to ensure all attendees are documented by the scribe.
Perfect.
For all Code Blue events, all documentation, including medication, will continue to be documented on the current paper resuscitation form. In most situations, the doctor will order the medications in the IEMR during the code. Nursing staff can utilise the Change User function to quickly change from the doctor's login so they can mark any medications as administered. For blood gas testing in a resuscitation setting, attach a regular patient label to the specimen and take to the nearest blood gas testing machine. All pathology and radiology ordering during a Code Blue or MET call will be ordered via the IEMR. Urgent requests will need to be marked as such and require communication as per current practice.
Thank you.
Remember to always label the correct sample with the correct label. If you do not do this, your pathology sample will not be tested. When performing an ECG, always scan the patient's URN barcode and enter their last name in the ID screen of the ECG device as a minimum. Once an ECG is completed, the ECG is transferred and printed. The printed copy is marked with the word copy and later inserted in the current encounter chart. The transferred ECG will need to be matched to the correct patient in Power Chart as soon as practical. It is important for the attending medical officer to increase the frequency of the patient's vital signs as clinically indicated. The medical officer can mark the patient as being unstable in IPASS so that there is a marker for the treating team and anyone else who needs to review the patient. This indicates that there has been a change in their clinical status. The medical team leader is responsible for ensuring that all medications not in the IEMR are transcribed into the system. In the situation where the doctor must leave for another MET or a code blue, it is the responsibility of the scribe to ensure all retrospective documentation of medications has been recorded into MAR as soon as clinically possible. This process will be supported by the Advanced Life Support team. If the doctor is required to leave, they must inform the scribe of their departure.